So very good evening, everyone. If we want to know about the Master Tung, I will give only 1 minute introduction about the Master Tung. Basically, Master Tung was from the northern China, but he was working in the army of Taiwan. And Master Tung has learned this science from his family only. Master Tung was not the first person who practiced Master Tung acupuncture. This is the very hidden and secret science of the Master Tung family. So we can tell Master Tung was the first person who shared this secret science. And if you go to the China, there are many clinics. They are telling first aid clinic. Suppose someone is getting a sports injury. Then they are doing treatment using Master Tung points, because Master Tung points are the point who create results on the table. Someone is telling you that suffering with a back pain, and you insert the needle and you can see results immediately. The cramps and the pain in the calf muscle, headache, shoulder pain, and you can see the results quickly. That's why Master Tung is very famous and spreading all around very fast because of the effectiveness of the treatment. In the Master Tung acupuncture, whole body can be divided in multiple parts. So whole body is having multiple parts, and even if you know turtle acupuncture, in the turtle acupuncture, the whole body can be divided in the 9 grids. Okay, 9 grids. So this is the upper body, this is the middle body, and this is the lower body. So the upper body means we can tell the brain, the middle body who is having our stomach, and the lower body we can tell the lower part, kidney, genital part and all. So in the Master Tung lineage, we can see the whole body can be divided in the multiple parts if we are putting points in the finger. Whether we are putting on the large intestine meridian or the small intestine meridian or the triple worm meridian or the lung meridian, anywhere, if we are putting the point in the finger, we are telling 11 number point. Suppose I am putting the point in the finger anywhere. Suppose this is the finger, index finger. This is the middle finger. This is the ring finger. This is the small finger, and even the thumb. I am putting point anywhere in any finger. If I am putting the point in the finger, then I will tell 11 number, like 11.01, 11.02, 11.03, and so, like 11.20, 11.25, 27, and all. So the meaning of 11, whenever we are putting the points in the finger. In the same way, if we are putting the points in the palm, so whether the palmar side or the dorsal side, we are telling it 22 number, like the 22.01, 22.02, 22.03. This is the classification in that way. So suppose I am putting the point here, anywhere, 22.01, 02, anywhere, whether the palmar side or the dorsal side, it is called 22 number. Right? Sometime it might be on the heart meridian, sometime it might be on the pericardium meridian, but we are not bothering for the name of the meridian. If the points is on the palm, the number will be 22. In the same way, if we are putting the point in the lower arm, we can see this is the lower arm. We are telling it 33. Like 33.01, 33.02, 33.03 in that way. So suppose there is a point, it's very good for the liver, and we are telling it liver gate, and this point in the L here, then we are telling it liver gate. That is 33 point something. Same another point here is very good for intestine. We are telling 33.01, 02, 03, 04. In that way, if the point in the lower arm, we are telling 33. If the point will be in the upper arm, we are telling 44. So the point here, where 44.01, 02, and wherever the points, whether in the front side or the back side, but if these points in the upper arm, we are telling them 44 point. Then we are directly jumping to the feet. If the point under the soles, we are telling it 55 number, like the 55.01, 55.02. If the points found under the feet, we will be telling them 55 number. The 66 number also the point of feet, but on the dorsal side. So whether the 55 number or the 66 number, both are the points. I will show you quickly here. 1 minute. So look at here. In the future, we will be learning lots of points like the point of the brain tumor under the sole, point of the kidney under the sole. Suppose we are looking the body. We are looking the feet. If the point under the sole here, anywhere, we are telling them 55 number. Like the 55.01, 55.02 in that way. Here. Like that. And if the point coming on the dorsal feet here, then we are telling them 66 number. Suppose if you ask me, suppose Master Tung is given some point here, we know in the TCM there is a liver too. But as per the Master Tung, any point coming on the dorsal feet, whether the liver too, or the gallbladder point, or the stomach point, any point is coming on the dorsal side, we are telling them 66 point something, maybe 66.01, 02, 03. In that way, we are having multiple points. Now we are going to the lower leg. In the lower leg, the points, they are called 77. In the thigh, they are called 88. Right? 77, 88. So legs over. Now 77 means whether the points coming in the front part of the lower leg or the point coming on the back side of the lower leg. Now when we talk about the thigh, if the point coming in the front part of the thigh or the point coming on the back part of the thigh, we are telling them 88 number. Like there are many points, they are good for infertility. They are coming in the thigh. There are many points, they are good for skin disease or the heart problem. If they are coming on the thigh, we are telling them 88 number, like 88.01, 88.02, then 10, 11, 12, 13, 14, 15, 16. In that way, number are proceeding. All the points coming on the ear. Master Tung has given only 8 points in the ear, only the 8 points. But these 8 points are bringing the miraculous results in each and every problems. So any point is coming in the ear, it is called 99.01, 99.02 to the 99.08. And finally, any point on the head and face, we are telling them 10, 10 point, means 10, 10.01, 10, 10.02, 10, 10.03 in that way. So this is a very simple classification given by the Master Tung. Now, if you ask me, Suppose we know DU20 as per the TCM. There is a point DU20. But as per the Master Tung, there will be some name like 10, 10.01, 10, 10.02, some name like that in the form of 10, 10. Other than this, if we are looking the front side of the body, suppose we are looking the front side of the body, any points coming in the front side, if it is coming on the chest or the abdomen, we are telling it BT. BT means ventral trunk. BT. Ventral trunk. So we are telling BT1, BT2, BT3, BT4, BT5 in that way. And last, if any point coming on the back side, maybe around the scapula, maybe around the spine, and all the back point as per the TCM, if the points coming on the back side, then we are telling them DT. D. The meaning of DT is dorsal trunk. The area of dorsal trunk. So it's a very simplest classification. This is a classification number 1. We are having one another classification we'll be discussing in the upcoming class. So now coming back to our presentation here. Look at here. The same thing is written here. If you go through, 11 means finger. 22 means palmar or the dorsal side of the hand. 33 will be lower arm. 44 will be upper arm. 55 will be sole of the feet. 66 will be the dorsum of the feet. 77 will be the lower leg. 88 will be the thigh. 99 will be the ear, in that way. Whatever we discuss, same thing, right? Then the next classification, next division, which we should know. Like we already discussed, the any points coming in any finger, whether the thumb or the index finger or the middle finger or the ring finger or the small finger, if they are coming better on the palmar side or the dorsal side or the palmar side. If they're coming in the finger, we are telling them 11.01, 11.02. But if you see the finger also having a rounded cylinder. Finger is also like a rounded cylinder, right? So there is a further subdivision of the finger. It's a very simple subdivision, I will tell you here. First, what we have to do? We have to make a very good cylinder of the finger. And we have to make the lines on the finger like A, B, C, D, E, F, G, H. Only 8 lines. So let's start with the line number only 1, line number A. The line A will be on the thumb side. So on the border of index finger toward the thumb side, that is the line A. Just remember the line A. So from the line A, we will keep on counting A, B, C, D, E, F, G, H, and make a full round and coming back. So look at my finger now. If you see my finger, so line A means this side line. On the side of thumb, this is the side line. Or we can tell the junction of black and white part, the junction of yin and yang. Okay, it's okay. Can you see me now? Right? So the junction of yin and yang. So this is the line A. Just first you draw the line A. If you draw the line A properly, then everything will be clear. So let's see. I'm drawing the line. Look at the line. See, if the line is right, then all the other line will be right. Line A on the junction. Now we are coming in the center of the finger. Then we are starting the counting line A, then the B, and this is the C line. Now you can see the another central line, that is the C line. So next, if you draw the line C, then you are moving on the right direction. So A just on the yin yang junction, C in the central, in between will be B line, right? B line, or we can tell the meaning of B line, we can feel the bone here. On the border of bone, there is a B line on the border of bone. So if I draw the B line will be like this. Now you can see A, B, and C. Now I reach to the central. Now if I draw the line on the other side of the yin yang junction, that will be E line, E. You can see this is another junction toward the middle finger, E line. So A, B, C, now D line will be in between. D. Now again D line will be on the border of bone. So I can draw the D line on the border. You can see A, B, C, D, and the E. E. Right? A, B, C, D, E. Now, if I draw the line just in the center of back of the index finger, let me draw it. This is the G line, G. G will be in the center. So now, starting from here, A, B, C, D, then E, then F will be here, then G, and the H will be here. So this line will be on this, the border of this bone, and another line will be on the border of other bone. So let's draw the last two lines on the border of bone. Done, over. Now, F, G, H. These lines are very important because see, now if I'm telling you, okay, let's go to the G line in the index finger, you can directly go to this line. Then it's very easy to draw, insert the point. If I'm telling, okay, in the middle finger G line, you can go in this line. In the ring finger G line, you can go in this line. If I'm telling, okay, in the small finger C line, small finger C line in the center here. So the drawing the line is a very basic thing, and these lines can be made in any finger. In the future, when I am discussing the point with you, I will be telling you in the middle finger, in the C line, then definitely you will reach directly to the center. Even the small finger. So 8 line in all the finger. Is it clear? Is it clear to everyone? There is no confusion. Very basic thing, but very important thing. Right? Is it clear? Got it? Wonderful. So let's move ahead. This was a very basic concept. Before learning the advanced aspect approach of the Master Tung, we should make a very strong foundation. Then quickly we can learn anything. I will tell you, join this point in the small finger C line, center point. Oh, in the small finger C line, in the small finger C line, center point. That is called joint point. Yeah, or yellow eyes point. Then I can explain why this is working on the jointis. But you should know this is the C line and this is the center point of the C line. The very good point, which is called yellow eye point, working for the jointis. Got it? Now, let's move ahead. So now, whenever we are measuring anything in the acupuncture, the measurement unit is chun, that we know. The meaning of chun is one thumb width. That is called one chun. Now, if I divide this one chun in 10 parts, suppose I'm dividing this one chun in 10 parts, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, in 10 parts. Then one part called one fan. Or I can tell one chun is equal to 10 fan. Like I am telling, we know, like the 1 centimeter is equal to 10. How many millimeter? 1 centimeter is equal to how many millimeter? Tell me. 1 centimeter is equal to how many millimeter? 10 millimeter. In the same way, 1 chun is equal to 10 fan. Remember this concept. 1 chun is equal to 10 fan. 1 minute. Why we should know 1 fan? It is very small unit. Still we should know, because when you talk about whenever you're talking about the finger is very small. Too small. And if you insert the needle, you can't insert 1 chun. It's not possible to insert the 1 chun needle in the finger. Then what we are going to do? We will be inserting sometime very 2 fan, sometime only 1 fan, very little needle. Because fingers are having very little place to put the needle. It's impossible to insert 1 chun needle in the finger because bones are there, bony part are there. So we should know fan. Fan is very smaller unit. Now, in the Master Tung, there is a very special thing that is called reaction area. Hold the Master Tung working on the reaction area. What is reaction area? Like there is a point, it is called 11.07. Definitely 11 means the point of finger. So the 11.07, we can see this is the index finger. In the index finger, this is the middle part of the finger or the middle phalanges. In the H line, there are 3 points. Remember in which line? Not the H line. A, B, C, D, E, F. F line. In the F line, there are 3 points. They are called 11.07. Tell me where is the F line? Tell me where is the F line? Even I will do the demonstration because these points are on the border bone. But right now, I want to know, as per your own understanding, tell me where is the F line in the index finger? Are you able to understand where is the F line? F. So in the middle part of the index finger, okay, this is the upper phalanges, this is the middle phalanges, the lower phalanges. So let's talk about the middle phalanges, and this is the F line. We have to insert the 3 needle, 1, 2, 3. I will show you. It's so simple. We can take sujog needle here. Even we can take bigger needle here. We will make pressing with the nail little, searching the border of bone. So one needle will be in the center. One needle will be in the center. See. And one needle up, one needle down. Look at here. 3 needles. 3 needle on the F line. So the name of this point is 11.07. As per the Master Tung, remember the formula of reaction area. Master Tung has told these points 11.07 will be working on the lungs. The reaction area is lung. Right? Okay, lung. If the reaction area of lung now compare with the TCM, where it is going to work? Needle will be perpendicular. In the Master Tung, forget the tonification and sedition. There is a never tonification, never sedition in the Master Tung. No tonification, no sedition, no electric stimulation, no machine. Right? Only the needling, just needling in any direction. So these points are called 11.07. The reaction area is lung. Wonderful. If the reaction area is lung, now everything is easy. Now we know what is lung. If they are working on the lung, so definitely they are working for the pleuritis, pleural infections, pleural pain, any problem in the lung. But the most important thing, they are working on the skin, because we know lungs are connected with the skin. Many females are having some emotional ups and downs, and they are developing black spots over the face. These are the wonderful point for the female who develop black spots over the face because of the emotional ups and downs. Because these points are very good for lungs, so definitely rhinitis, sinusitis, running nose, these points are going to work. These points are very good for lung, very good for skin. So any skin infection, pus discharge from skin, roughness of the skin, psoriasis of the skin, eczema of the skin, even the skin inflammation of the ear, there is a pus discharge from the ear. These points are working very nicely. That's why they are very good for otitis. The meaning of otitis, inflammation of the ear. Right? So we are using these points for cosmetic acupuncture because these are the wonderful point for this purpose. Master Tung has told these points are very much useful for the lacturia, means there is a milk discharge, unusual milk discharge from the breast. So these are the 11.07 point. Why they are working on the skin? The question comes, why they are working for the skin? So you should know what is the reaction area. And these are the wonderful point. Just 3 points. Remember one thing. In the Master Tung, we don't use much point. Suppose you are doing the skin treatment, finger rapid horses, and use 1 or 2 more points, done, over. Don't try to insert too many points, because even these simple points are able to create excellent results. Let's take another example. So I'm taking another example. This is the middle finger. Definitely the point coming in the finger, whether the middle finger or the index finger, they will be 11. So these are the point. This is the point card 11.09. 11.09. We can see this is the middle finger. In the middle finger, if we go on the F and H line, we know on the one side we are having F line, on the other side we are having H line. Draw the 2 points in the center. They are called 11.09 or the heart knee point. Definitely you will easily understand why we are telling them heart knee. As per the Master Tung, if you want to treat the knee, then treat the heart. All the points having reaction area, heart, they are very good for the knee. So when you are putting the point on the 11.09, this is a very good point for the heart. That's why this is a very good point for the knee, right? 11.09, one of the great points for the knee pain. If there is any problem, the kneecap, weakness of the knee, pain around the knee, especially on the medial side, right? And definitely pain in the heart. In the Palmer diagnosis, you will able to understand why the heart point coming in the middle finger. Why in the middle finger? In the Palmer diagnosis, you will able to understand. So this point is the dorsal side. So look at here, this is the middle finger. So where is the F and H line? Definitely the middle line is G. So one side will be F line and one side will be H line. Both the sides. So if I'm putting 2 points here, 1 point this side, see 1 point this side, and 1 point on the other side of the bone. These points are not creating much pain, only 2 points on the border of bone and very little insertion here. So these points are called heart knee, and very simple. If you see, suppose this is the whole body, head region, chest region, abdominal region. If this is the chest region, definitely heart will be here somewhere, right? So the heart knee point coming here, and if you treat the heart, you will able to treat the knee. As per the Master Tung, if you want to treat the knee, forget the knee, just treat the heart. And definitely, if the person is having right knee pain, we are going to add these points in the left side. So what I want to tell you, in the Master Tung, everything is on the reaction area. Here also, if you see reaction area, because 11.09 points coming at the middle part, which is at the location of heart, the reaction area of heart, that's why they're working on the knee. In that way, we can see every point is having, we are going to discuss, every point is having some reaction area, all the points having some reaction area. We can see some point is having liver reaction area, some point has a kidney reaction area, some point is having different reaction area. In the whole body, there are too many points. Some point is having multiple reaction area. So as per the reaction area, these all points are working. There are some extra points also, but all points working as per the reaction area. These points are spread all around. So right now, just I'm giving you reference here. One by one, we are going to discuss. We can see these all points having reaction area, right? So now I'm coming here to the Palmer diagnosis, where we will able to understand little more meaning. So Master Tung palm diagnosis is telling, whenever you are treating the patient, first you should observe the palm. You should see the palm. You should see each and every area of the thumb, index finger, middle finger, ring finger, small finger, even this palm area. You need to see whether there is some changes in the color of the palm. Sometimes some area become red, some area become blackish, some area become wrinkled, some area having some lump. So you should observe each and every area of the palm. Second, you should observe the swelling, whether there is a swelling somewhere. If the swelling somewhere, it means there is a dampness in that part. Third, we should see if there is a vein, blue color vein here, anywhere. Suppose blue color vein here, or you can see the blue color vein here, they are also giving some idea. So in the Master Tung palm diagnosis, you should see each and everything. Now we can see here, everything is very clear. If you look at the index finger, in the index finger, starting from the index finger till the lung 10, we know here is the lung 10. This whole area is doing the representation of the metal element. Metal element means lung or the large intestine. If any swelling is there, we can tell there is a dampness in the lung, there is a dampness in the large intestine, or there is a humidity in the lung, there is a humidity in the large intestine, because this finger is doing the representation of metal. Whether you see palmar side or the dorsal side, front side or the back side. Suppose you are finding some blue vein here, somewhere, blue vein here. It means blue is the color of stagnation. Black is the color of stagnation. Right? Something is stuck, energy is stuck. So then we have to work, we should treat the points of the who can balance the lung and large intestine, who can balance the metal. So the index finger to the lung 10, that is the area of lung. So look at my hand. So this is the index finger. If from the index finger, I'm moving down and I'm coming to the lung 10 point, this whole area is doing the representation of the lung. That's why I am putting the point here, the reaction area of lung. Even I can put the point anywhere in the index finger, like we will be seeing 11.01, 11.02, 11.03, 11.04. The reaction area of all the point is lung. They are working in a different way. Because this area is connected with the lung, even this area is going to treat the lung. In the same way, if we talk about the middle finger play a very important role as per the Master Tung. Middle finger is the finger of brain, finger of pericardium, finger of heart. Master Tung mostly using this image. So this is the head region, head. All the brain point will be available in this finger, and the heart point also available in this finger. That's why when we are inserting the 2 point here, we are telling it that heart knee point, the reaction area of heart, and they are working on the knee. If you see in this image. So this is for diagnosis. We are doing the diagnosis by here, and we can put the point anywhere. We are going to learn, because first the diagnosis is important. We are finding some swelling, so there is a dampness, there is a flame in the heart. We are finding some blackish color or the darkest color is the color of stagnation. Stuck energy is not flowing properly. So we are seeing the blackish color here. So starting from the middle finger till the pericardium 8. So this is the pericardium. This is the pericardium 8 here. From here to here, this area doing the representation of the heart. Any disharmony in this area, it's showing there's a problem with the heart. Even the nodule, any changes that is connected with the heart. So look at here. So we can see here. So this is the heart area, middle finger. till the pericardium 8, we can see middle finger to the pericardium 8 doing the representation of the heart meridian. Now you're looking the swelling. Swelling is doing the representation of dampness or the phlegm. Now suppose someone is having dampness in the heart. You know what is happening. Dampness. Dampness is invisible. Dampness is like a ghost. Ghost is invisible, but still having great power. Right? So dampness in the heart, if you see the X-ray, if you do the MRI, you will not find anything, but the person is feeling lots of heaviness in the heart. And dampness or the phlegm is very subtle. Many persons are suffering with the mental retardation because of phlegm in the heart. Because if you want to be very intelligent, your heart should be neat, fully clean. The clean heart is wonderful. And it's giving you excellent memory. Memory is coming from the heart. But there is a flame over the heart. It is invisible. It's not visible. It's like a ghost. Whether the person will be feeling too much heaviness or many mental retarded kids, as per the TCM diagnosis, what is mental retardation? The mental retardation, flame over the heart. Even the schizophrenia, person who is doing hallucinations, means your heart is not clean, because when the cloud is there, you can't see the sky. In the same way, if flame is like a cloud, if flame is over the heart, you can't see the thing clearly. You are not having clear perception. So we will find some changes here at the middle finger or below the middle finger in this area. Let's move to the ring finger. Ring finger is the finger who is having connection with the liver and spleen. So starting from the ring finger till the wrist crease, this whole area is doing the representation of the liver and spleen. Now suppose some redness is there. It will be showing liver heat. If the pale color is there, it's a deficiency. Pale means no blood. Swelling is there. Oh, it's showing the dampness. If the blue color vein is there, that is also showing the energy is not flowing. Blue color vein is not good if you find a very big blue color vein. That is a sign of energy stagnation. So the ring finger is very deeply connected with our liver. I will give you an example. You know that. Let's see this a few examples. There are very wonderful Master Tung point. Look at here. There is a wonderful Master Tung point. It is called 11.20. 11.20. There are 2-point unit. Here in the ring finger, these points are called liver fire point or the wood fire or wood blazing point. There are many names, wood blazing point or the 11.20. The question comes, why these points are the ring finger? Because as per the Master Tung, the ring finger is connected with the liver and spleen. Mostly upper part of the ring finger is connected with the liver and the lower part is connected with the spleen or might be liver. And this point is so wonderful. I will tell you in which line. This is point in the F line. F. In the F line, if you draw 2 points, these points are called a liver fire point. Excellent point for liver fire. So this is the ring finger. Now you know where is the F line. Starting from A, center point is C, side point is E, then the F line. Sorry, it's not in the F line, sorry. It's on the D line, D. So starting from A, then center point is C. And if you are going in the D line, D. So I will insert the needle here. I will make the point first here. You can see these 2 points. In the ring finger, in the D line ABCD, on the border of bone, there are 2 points. They are connected with the liver. They called 11.20 or liver fire point. What is the meaning of liver fire? When the liver fire is rising, means person is having too much anger. When the liver fire is rising, it will liver is the mother of heart. It will raise the high BP. When the liver fire is rising, it even person is having too much heaviness in the head, migraine headache, even the blood vessels of the brain might rupture because of the liver fire. When the liver fire is there, the liver will be having too much heat, hotness. Initially, there will be fatty liver, then there will be cirrhosis of liver. If the person is suffering with the cirrhosis of liver or the fatty liver or any serious condition of the liver, we are going to use 11.20 point. 11.20 points are wonderful point to calm down the liver fire, to calm down the blood pressure, to calm down the anger, because liver is having connection with the anger, right? 11.20. So we can insert the needle on the border bone here. I have inserted these points for one of my patient who was drinking alcohol. You can see the needle. One patient was drinking alcohol, then because of the continuous drinking, initially he suffered with the fatty liver, then the fatty liver grade 1, fatty liver grade 2, then the cirrhosis of liver, then there is a perforation in the liver, then deposition of the water in the abdomen or the peritoneum or the ascites. I used 2 points. One was 11.20 and 1 point was some other point. And I got wonderful results within 15 days. And even you will also get wonderful results. These are the really excellent point, or called wood blazing liver fire. In the same way, I would like to give you 2 more examples of the other finger. Okay, we have seen this example already. We already have seen this example here. We have seen this. Okay, now I'm coming to the small finger. A small finger is the finger of kidney and the urinary bladder. Right? Kidney and the urinary bladder. Any dark coloration here is showing there is a stasis of kidney, there is a stagnant of energy of the kidney, there is a disharmony of the kidney. Even the red color is showing there is a heat in the kidney. So any sign which shouldn't be there, if it is there, it is showing some disharmony. So it's not only about the upper part of the small finger, even I am telling, even in the palm, anywhere we are seeing this sign, even the front side, means palmar side or the dorsal side of the palm, this area is connected with the kidney and UV. But if we are putting the point in the finger, we are telling them 11. And if we are putting the point in the palm, we are telling them 22. Whether the 11 point unit or the 22 unit, if they are coming in this area, they will be connected with the kidney and urinary bladder. Let's see an example here. So I am going to give you one example. There are 2 points. They are called kidney chi escort. Kidney chi escort. We can see the 1 point is here and 1 point is here. 1 point is called 22.08. Another point is called 22.09. This study will be very systemic. Right now, just I am focusing on the palmar diagnosis. And I want to tell you, 1 point we are putting here, 1 point we are putting here. The both points are having connection with the kidney. That's why they are working for the back pain or the whatever pain. As per the TCM, we know is the location of small intestine 3. We know this is the heart line. And this is the location of small intestine 3 here. But as per the Master Tung, this is the 22.08. Same point, SI3. And as per the Master Tung, the name of this point is kidney chi escort because it's coming in this area. This is the kidney chi escort. It will be working on the kidney chi. It is an excellent point for pain of the bone, especially lower back pain. And now, if you are measuring the distance from the wrist, it will be near about 2.5 chun. Measure 3 finger from the wrist. If I measure, so 3 finger means 2 chun. Little more, 2.5 chun. So this is the point 22.08 or kidney chi escort. Right? Now, as per the Master Tung, if you go 1 chun down, there is another point, 22.09. It's also a wonderful point. But we never needle both points at a time. Either we are putting this point or we put this point. We are not putting both the point at a time. And we never put these 2 points bilateral. Either we are putting the right side or the left side. Patient is telling you that I'm having pain in the right side, then we are putting this point on the left. So we have to use the point on the opposite side or the contralateral side. So that is 22.08 or 1 chun down 22.09. So question comes, there are too many points are treating the lower back pain. So how to decide when to use this, when to use other? So the answer is this. Suppose someone is having back pain and this back pain is having connection with the dampness. Then we use this point. What is dampness? Suppose there's a raining around and you are sitting on the cold stone. Or even it's not raining near the river, it's a wet surface and you are sitting on the cold stone, it's a dampness. Then you are creating back pain. Or suppose you're sleeping on the floor is very cold. Or living in the damp house, dirty house, using the dirty cloth. Dampness means the dirtiness. And suppose you are wearing the wet clothes, you are sweating a lot. But if you are not changing the clothes, same clothes you are wearing for a long time, then you are suffering with the pain. So that is a dampness. Dampness means dirtiness. So whenever anything is coming with the dampness, then use this point. Okay, so many times pain is not connected with the dampness. We will use other point, right? So just today we discussed a little about the palmar diagnosis. We will be discussing more in the few upcoming session. So enough for today. So let's close the session today. Now we'll be seeing on the same time day after tomorrow, because tomorrow is my flight from Hyderabad to Vadodara. So tomorrow will be off on the 8th. Still 8 is a holy. We are going to have the class, right? So now we'll be meeting on the 8th. This course will be very wonderful in the highly upgraded version. Thing will be very simple, but the concept will be very deeper, right? So let's close the session now. See you in the 8th March. Thank you so much. Closing the session.